Good afternoon, Professor Zhang. It's a great honor for us that you can accept our invitation and talking about probiotics and maternal nutrition within I followers. So as you know, pregnancy is an important and special period for females and also for the whole families. They have significantly different and growing needs for nutrients. However, their bodies change a lot, especially the GI system. So my first question will be, how exactly will their GI system change and what are their consequences?
It's my pleasure to answer your questions. It's very interesting during the pregnancy. You may know that when a woman pregnant, a lot of things change. First, maybe the endocrine system, the regulation. For example, maybe some estrogen, for example, progesterone and estrogen increased. And so you may know that the plant star biochemical well, it it can transfer a lot of nutrients the fetus needs. Then, so you know that it makes a lot of difference in the gastrointestinal system also. For example, you know that the motility of the gastrointestinal changed slow than before. And also the digestion liquid decreased the secretion. And on the other side, the vaginal pH changed also. And the blood lipid changed. For example, the lower density lipoprotein changed the higher. It can reach the more than 150% of the normal than before. So, you know, at this period, it can make the gastrointestinal change. It can also change the balance of the pregnant mother's gut microbiota. So you know that it has a lot of different evidence show that one of the bacteria is a poisonous bacteria. It's called the Listeria. It has close relation to the miscarriage during the pregnancy. And also it has some data show that the gestational diabetes mellitus, we call it GDM, that disease increase is also related to the gut microbiota change. And also, you know that it can influence the mental health. For you may know that the gut-brain axis, and you know that the maternal depression and anxiety, especially post-partum depression also. So and also other problems, for example, vaginal bacterial vaginosis, and also related to the rate of the infant's allergy. And it influences the maternal and the future of the maternal health, for example, allergy, and also the new infant's allergy also. So I think that this is what the gastrointestinal change influenced the maternal and the infant health. Thank you.
Thank you, Professor Zhang. And as you have mentioned, the key function of microbiome. So how could pregnant females maintain the balanced intestinal microbiome? And what are their benefits is there any way that they can improve the condition, the consequences that you have mentioned?
It's very interesting that you know that the gut microbiota balance changed, and it can influence the maternal and the infant's health. So it's so you can, when you search PubMed and all other published database, you can see a lot of published data paper related to this field. For example, you know that if the pregnant mother get probiotics, they can you know that they can get some probiotic supplements. You know, the benefits, I think that from all the published papers, I concluded that's below. For example, first, it can improve the metabolic and the fasting glucose of the GDM pregnant mother, the gestational diabetes mother, the first. Second, you know that it can also improve the insulin resistance of the pregnant mother. And a lot of published papers conclude that it can be helpful for the mother or the parents who have allergy. And you know that it can decrease the risk of the allergy risk of the new infants also. And you know, from some published paper, it reported that it can improve the maternal health, prevent the infant eczema and allergy also. And you know that it can improve the mental health of the mother, and you know that it can influence the post-partum depression, anxiety, and it can improve the cognition. And also have some paper reported that it can, when mother at the pregnant and the lactating period, they get some probiotics supplement. It can improve the new infant's cognition. It's very interesting. And it can also, you know, that now there are a lot of pregnant mother, pre-pregnant, they had overweight and obesity. And it had reported that it can decrease the tissue composition, the fat tissue composition, and it can helpful to their weight control and weight retention after the pregnant. It's very interesting.
Oh, okay. I see. So besides the pregnant, lactation is another special period with growing needs for nutrients and big changes of bodies. So how could moms during their lactation period get balanced intestinal microbiome? So is it similar with pregnant females?
You know that the very famous study of the PIP, that's the probiotics for pregnant and lactation. You know that during the pregnant and the lactating period, the mother get probiotics, and it had some effect on the new infants' growth, their weight and height gain at 12 months. And so you can, from this study, you can see some influence the mother take, when the mother take probiotics, it can be healthy to their children, to the new infants, to their growth. And also there are some literature related to pregnant and lactating mother. When take the probiotics, it can improve the mental health of the mothers. For example, for the postpartum depression and some mental health related problems. So, if a mother, when pregnant and lactating period, get probiotics supplements, it can make her more healthy.
Okay, so since probiotic supplement is quite valuable, so is there any safety issue about probiotic supplementation? Is there any specific strains of probiotic that could be recommended for moms?
That's a good question. I think that that the probiotics first, if you choose a kind of probiotics, for example, bifidobacteria or lactobacillus, and when you take it, that the health care providers, I think they must check if this kind of, especially maybe not only it belong to bifidobacteria or lactobacillus. It, that you can check the strain. Also, that you can check if it on the name list of Food Drug Administration of USA, it can be on the list of GRAS. We call it GRAS. And also it's on the Europe, the name list of QPS. If it belongs to the two name lists, it means that it's safe. And also, I think as a scientist and a nutritionist, I think that if the probiotics you take, it had some evidence on maternal health and new infants health, it had some evidence and clinical trials, for example, RCT clinical trials, it had this kind of result. It can prove it's safe and maybe had some effect on your health. So you can choose this kind of bacteria in your health. The first one. Second, when you take the probiotics orally, I think you can drink it. You can orally. You can use some water. The water, I think maybe that the hot temperature will kill the probiotics, kill the bacteria. So you can select the room temperature water, not too hot. And also, that the gastric acid may influence the effect of the probiotics. So I suggest that it may be nice to take after your meal.
Thank you for your time and the great talking points, and have a nice day. Thank you.
Have a nice day also.